viewer, you are welcome to Health Issues with Dr. P.E. Ngwo. In this episode, we are going to continue our discussion on prostate cancer. This is our second episode in this particular series. And the topic is prostate cancer, what you need to know. So, the number one thing you need to know is that prostate cancer is different from the ordinarily enlarged prostate. They are never and they can never be the same. Number two thing, or the second thing you need to know, is that prostate cancer does not have symptoms in the early stages. Early stages of prostate cancer, and that is the stage where cure can be gotten. The early stage of prostate cancer, when the cancer is still within the prostate, usually there are no symptoms. When you start having symptoms, most times prostate cancer has gone beyond the prostate. Number three, the third thing you need to know about prostate cancer is that prostate-specific antigen, or what we call in the short form, PSA, is very, very important. PSA is very, very, very important in terms of screening. And that is why we advise that every man that is 40 years to 45 years and above, especially if you're black, if you have black or African ancestry, then you need to check your PSA once in a year, at most once in 2 years. The whites can check their PSA that way from 50 years and above, but for blacks, 40 years or at most by 45, you should have started doing what I'm talking about. Check your PSA once in a year. This is just like I told you that early prostate cancer does not have symptoms. It is this PSA, prostate-specific antigen, that helps us to detect early prostate cancer. So if you do a PSA and the PSA is high, that will prompt us to look further. And remember, if you're going to do a PSA, do your PSA and have a check with a urologist. I am a urologist, so you have other urologists. Do a check with your urologist. Your urologist might want to do what we call digital rectal examination, checking how your prostate feels. In addition to seeing the PSA, you might want to do a digital rectal examination to check how the prostate feels. So a combination of how the prostate feels, the level of the PSA, might inform you're being asked to do a biopsy. If PSA is high, we might want to do a biopsy to check if there's cancer in the prostate. If the digital rectal examination findings are abnormal, we might also want to discuss with you and advise you on doing a prostate biopsy. Then what does a prostate biopsy involve? Prostate biopsy involves using a special needle to take some tissues from the prostate, from different aspects of the prostate. Usually we prefer what we call ultrasound-guided prostate needle biopsy, not the digital or the blind prostate needle biopsy. So under ultrasound guidance or fusion prostate biopsy, where you have magnetic resonance imaging fused with ultrasound to look out for abnormal areas, we take a biopsy, which means taking some tiny tissues from the prostate. This will be put inside a container with a preservative and sent to the pathologist, who will now analyze this tissue and tell us whether there's prostate cancer or not. Now, if it turns out that the result is showing that there's prostate cancer, what do we do? The next thing to do is to stage the prostate cancer. It is not right to outrightly go ahead to start treating prostate cancer without actually knowing the stage. In fact, that's the rule. That's what it should be for every cancer, whatever cancer it is. You should know the stage. So in that case, the magnetic resonance imaging and where available bone scan can help us to determine the stage. On the other hand, you can also do what we call PSMA PET scan. PSMA PET scan. PSMA PET scan, the cost is on the high side, but if you can afford that, you can also have a PSMA PET scan. So you do these investigations to know the stage of the prostate cancer. So that stage will stand what determines what we are going to do for you in terms of treatment. The treatment for stage 1, stage 2 prostate cancer is not the same thing for stage 3, it's not the same thing for stage 4. And I want to state categorically here, the reason these things are important is because for stage 1, stage 2 prostate cancer, we can offer you curative treatment. There's curative treatment for stage 1, stage 2 prostate cancer. Keyhole surgery for prostate cancer is available. We do these procedures. Keyhole surgery for prostate cancer, open surgery for prostate cancer for people that have early prostate cancer. And this can be curative in early prostate cancer. Keyhole surgery can also be done in stage 3 prostate cancer, but that will also involve adding other therapies to help in the person's treatment. For stage 4 prostate cancer, keyhole surgeries, we also call them radical prostatectomy. Radical prostatectomy could be open radical prostatectomy or keyhole or laparoscopic radical prostatectomy. Other options include things like radical radiotherapy, cryotherapy, and some other therapies. But these are the key ones that can be done for patients with early prostate cancer. For people with late prostate cancer, stage 3 prostate cancer, stage 4 prostate cancer, things like use of drugs, like the anti-androgens, like the gonadotropin-releasing hormone antagonists, analogs begin to come in. Things like removal of the testes or use of some of these medications begin to come in. So, in a nutshell, these are the things you need to know about prostate cancer. Early diagnosis is very, very important. PSA is very, very important to determine, to know when prostate cancer is coming up in the early stages. And you should also know that treatment is readily available. And treatment options varies from one stage to another stage. Thank you very much for listening. Watch out for us in our next episode as we continue our discussion on prostate cancer. Do well to share this video. A lot of men need to know all these things. Information is very, very important. Thank you very much. See you in our next episode.
Is Elios. Welcome to Elios Specialist Hospital, where cutting-edge technology meets compassionate care. Right at the heart of Abia State's capital, number 32 Azikiwe Road, Umuahia, Abia State, Nigeria. Elios Specialist Hospital has become a trusted brand. A known center for endoscopic surgeries, laser procedures for kidney stones, kidney procedures for prostate cancer, which offers the chance of cure for early prostate cancer, amidst other general surgical and gynecological keyhole surgeries. Our team of experts are dedicated to providing comprehensive, state-of-the-art care. Visit our website today at www.elioshospital.com. For more enquiries, please call 0816-3666-022 or 0916-9451-090, or follow us on our Facebook and Instagram at Elios Specialist Hospital. Do well to subscribe to our YouTube channel at Dr. P.E. Ngugu, where you'll be exposed to an array of video tutorials and lectures by our MD, Dr. Paul Ngugu. Elios Specialist Hospital, Center for Urologic and other minimally invasive surgery.